Hello, I'm Dr. Barry. I'm a board-certified plastic surgeon here with Wake Plastic Surgery. Today we're going to be talking about some frequently asked questions related to some common facial rejuvenation procedures. We'll be talking about face and neck lifts, brow lifts, and upper and lower eyelid lifts or blepharoplasties. So an eyelid lift or blepharoplasty is a surgical procedure that aims to address excess skin and fatty tissue of the upper or lower eyelids. It addresses puffiness, sagging, heaviness of the lids to really get you a rejuvenated, youthful result. You do not. So it really depends on what is bothering you. So some people have more signs of aging in their upper lids, some more in the lower lids, or some in both. And so this is something that can be done individually or in combination, depending on your anatomy and your goals. If you have excess skin, fullness in the upper eyelids, and that can be addressed by an upper blepharoplasty in isolation. If you have fullness of the lower lids, excess skin, under eye bags, dark circles, then those can be addressed with a lower blepharoplasty. So that's a great question. So your under eye bags generally are treated very effectively by surgery. That's usually caused by excess skin and bulging fat of the lower lids. And so blepharoplasty, which removes and repositions that fat, works very well in smoothing that area. Dark circles have many different causes. And so one of the reasons for that is pigmentation, another is thinning of your skin, and another may be just volume loss in that area that creates shadowing. These are addressed in different ways, and it may include skincare or even fat grafting to that area to add volume at the time of your lower blepharoplasty. So this is something that's really dependent on your individual anatomy and something that we'll discuss at the time of your consultation. So fat grafting is definitely a very powerful tool to help rejuvenate the face in general, but especially around the eyes. And so what we find is that a blepharoplasty, a lower blepharoplasty specifically, not only removes but also repositions fat depending on how it's done. But for people that have had volume loss in this area, fat grafting helps to restore that volume and also to blend the junction between your eyelid and your cheek to really get a more harmonious, youthful result. Yes, you definitely can, but this is something that you'll want to disclose to your surgeon, because if it is causing any sort of distortion to your anatomy in that area, especially if it was recently placed, we may want to dissolve it so that we can have a more predictable final result once that filler is gone. So that's a great question. So bromelain and arnica are natural supplements that can help reduce swelling and bruising after surgery, particularly helpful with surgeries around the eye that are prone to swelling and bruising. Some patients love using these, and they are usually very safe but optional. And so this is something that I would discuss with your surgeon, so we can definitely tie that into your surgical and recovery plan. So medical grade skincare does play a pivotal role in optimizing your blepharoplasty results. While we address excess skin and excess fatty tissue with surgery, we don't impact skin quality. And so medical grade skincare products, which include components such as retinol, peptides, antioxidants, those can have a significant impact on your overall skin texture, tone, and really help you to maintain longevity of your results. And so it's something that should be a part of your overall surgical and recovery plan and long-term facial care. So most people feel comfortable going back to work within a week after an upper blepharoplasty and within 10 to 14 days after a lower blepharoplasty. Most of the bruising and swelling is significantly improved by then and able to be concealed with makeup.